Hello, I'm Wayne Greene, Editorial Pages Editor of the Tulsa World, and welcome. Today, we're joined by Mayor G.T. Bynum. Let me say that today is November the 20th, so anything that the mayor says should be kept in that context. Thank you for joining us today, Mayor Bynum. Uh, for our viewers, can you tell us what's been the hardest part of trying to deal with the COVID challenge in the city of Tulsa?
Um, I think the hardest part is that we're dealing with this in an environment in which there is so much access to misinformation that's out there, and to be effective in anything that we do in fighting this, we're most importantly reliant on persuasion. That's something that Mayor Holt in Oklahoma City and I talk a lot about, that everything that we've done to respond to this, really it requires the folks that live in our communities to understand why we're doing it and buy into it and carry it out. I can issue executive orders all day long, but if people don't agree with it or support the need to follow through on it, then it's useless. Same with our ordinances that we put in place in response to this event. And so you have, I think, especially as it's gone on, you've had fatigue creep in around people that just want this to be over and want to get back to our lives the way they were. And trust me, nobody wants that more than I do. We have so many good things we've been working on in Tulsa. I would love for us to just be able to focus 100% of our time on those rather than a pandemic. But the reality is that it's here and it's all around us. And we as a community are going to determine, and as a state are going to determine how effective it is at killing our neighbors. And so, when you have something as simple, in my opinion, as a mask order. I mean, that's probably the most controversial one, though I still don't understand the controversy around it. You have something where all of our local hospitals are telling us they need to have it in place. Our health department is telling us that we need to have it in place. The State Medical Association is telling us we need to have it in place. The Hospital Association, the Nurses Association, everybody that is tasked with protecting our health as Tulsans and Oklahomans are all telling us that this is one of the most effective things that we can do to slow the spread of this virus and to protect ourselves and our neighbors. And somehow it's become political, and somehow it's become hard for local communities to adopt it, and apparently an impossibility for the state to do it. And I think so much of that comes back to misinformation that people have access to because of the proliferation of social media, where everybody is suddenly an armchair expert. And I've really tried, as an elected official who's tasked by my bosses with protecting them, to rely on the actual experts, especially the ones that have local an understanding of the data and the needs on the ground here in Tulsa. So that's probably the biggest challenge for me, is that the longer we talk about this and the longer that we argue about it, the harder it becomes for me to persuade people to do the right thing. And so that, I'd say that's definitely been the biggest challenge in the midst of this event.
Well, it's an enormous challenge. We thank you for your time today, Mayor Bynum.
Thank you.